Okay, I just want to try to answer a few questions that you may have. So there are certain questions that I get asked all the time about the neurofeedback, so you may have some of these questions. So first is, what are the sessions like? How long are the sessions? Generally the sessions are 45 to 50 minutes. With children, usually we'll hook them up, and then I'll talk to the mother or father for a little bit, find out what's going on, then come back in, talk to the child, maybe work on whatever issues are there, and then the child is hooked up with the EEG biofeedback and goes through the session with that. One of the things that people ask is, do we put anything into the brain? And no, we don't. This is completely non-invasive, so there's no electrical stimulation. Even if lightning strikes the building, there's a fiber optic cable between the computer and the person's head, so there's no way that any electrical current can enter the brain. So it's a completely safe, harmless, painless experience. How many sessions are needed? Again, that's hard to predict. If it's maybe an anxiety disorder or a sleep problem, it may be 10 to 20 sessions. If it's ADD or a significant depression or anxiety, then we may be looking at 30 to 40 sessions. If it's a learning disorder, Asperger's syndrome, autism, then we're maybe looking at 60, 80, 100 sessions. And that's where I'll oftentimes talk to people about having a home unit where they can do those extended sessions at home. Does insurance cover it? I'm a licensed psychologist, and so this is billed as a psychological treatment or individual psychotherapy. We do talk therapy, family therapy, cognitive behavioral therapy along with the neurofeedback. So we're doing a combination of things during each session. You'll have to check with your insurance to find out if we're in network or not in network, and find out what your coverage is and what your deductible is. But I usually try to have an intern that I'm training so that if people don't have insurance, we can have them see the intern for a much reduced rate than what we would normally charge. People ask if they have to keep coming back. Generally once treatment is done, it's done. I do have some people that will come back later, usually if there's another stressor in their life, another problem, a setback, then they may come back for more sessions. But generally once the brain learns something, it maintains it. So they've done 15-year follow-up studies with people who've had EEG biofeedback and found that generally those results that they got 15 years ago are still present. So it's really encouraging to know that when you come in, that things are going to change. You're going to have a different brain at the end than you did at the beginning, and it's going to be a much more efficient brain that's going to make your life much more beneficial. If you do have any other questions, we're always available. Just give us a call, and we'll try our best to answer all your questions. So I'm wishing you the best of luck.